I'm Susan Blain. I'm the founder of the Dare to Be Vulnerable project. Welcome. This project is determined to break the silence, bust the stigma, remove the shame, and ultimately save lives by talking about our mental health. And I like to say, we're on a mission to make talking about mental health cool. So today's conversation is a collaboration of the Youth Services Bureau and their series Mind Matters with Bell Let's Talk. And Youth Services Bureau has been serving at-risk youth in Ottawa for over 60 years. They are the largest and most comprehensive nonprofit agency in the city, and they have over 350 caring professionals that work in over 20 different locations that offer tons of resources and services to support youth and their families. And at the end of this video, we're going to provide you with a list of resources that you can tap into, so look out for that. And the intention of these conversations is to help guide us through our struggles, through our mental health struggles, and to remind us that we're not alone. I've discovered myself that there's no quick fix, there's no easy button when it comes to our mental health, and that each of us are responsible, I like to say, to build a toolbox or a roadmap for ourselves to optimal mental well-being. I've had my own personal struggles with mental health, and I've learned that we're in this together and we need help from each other. So asking for help is a strength. And if you take anything away from today's conversation, I hope you take away that. Today we're here with Leah Paul, and she is a youth and family counselor with YSB, Youth Mental Health Services. And I'm just so thrilled to have her here today. Welcome, Leah.
Thank you so much for having me. Yeah.
We need more people like you in the world, Leah, doing the work that you do. So thank you so much.
Yeah.
Now, we're going to talk about eating disorders today.
Yep. Mm-hmm.
So tell me about the work that you do.
Yeah, it's a very incredible work that I get to do. So I work with youth and parents and families affected by eating disorders and other challenges.
Yeah.
It's a big issue these days.
It's a big issue, eh?
Yeah.
And
Yeah.
bigger than it used to be?
I think it's always been around, but I think the pandemic just kind of
Turned up the dial.
We're aware of it now more.
Yeah. So do you think the pandemic has increased the number of people suffering from eating disorders?
It's hard to say for sure. There was definitely an increase in hospitalizations.
Yeah.
I think there was close to 60% increase in hospitalizations at CHIO, so the Children's Hospital here in Ottawa.
Yeah.
For eating disorders during the pandemic alone. So it's just quite scary for so many families, and the need is quite high. And we saw how that really impacted the services that.
The demand, right? The demand on the services.
Mm-hmm.
What are some of the things that we as family or friends should be looking for? To identify someone who's struggling.
It's a very good question. I think when we think about eating disorders, it's a very kind of secretive disorder. So people are very scared to talk about it. They feel a lot of shame when they have this disorder. So that's why it's very hard to even diagnose it, because it is so secretive and not really talked about.
Yeah.
So the challenge is that for parents, they may not even see the signs because they think it's just normal behavior. So I will kind of run through a list. Maybe that's helpful.
That'd be great. What are some of the signs?
Yeah. So one of them could be you're seeing, your youth is not really coming down for meals as much, is making up excuses, doesn't want to eat as much, restricting food is a big one. Saying, I don't want to. Talking about how they feel about their body, how they don't like their body. That's something that a lot of young people are dealing with a lot these days, I think, and it's a big challenge. And also just there can be even a a lot of purging, so throwing up sometimes after meals. That's something that shows up for some youth dealing with eating disorders. And some over-exercising. So if you're seeing youth exercising a lot more than they need to be exercising, then that's an indication that something's up. And of course, the big one is weight loss. So if you see a youth that's typically a certain size and you see a change in their body size, that's a very serious indicator that something wrong is going on for them.
Well, those are some that seem like obvious signs, but we as parents or family or friends, need to watch out for. Is there a certain sort of age that an eating disorder is sort of comes to surface?
It's a great question. I think we're noticing that they're showing up earlier and earlier in young people.
Wow.
So they're coming up, a lot of youth are now dealing with it as I worked with youth, starting at 12 years old or 11 years old. So even some kids deal with it at 8 years old, 10 years old. Usually shows up more during the puberty period, because that's when a lot of body changes show up.
That makes sense.
So I think that's when we're noticing a huge shift for young people.
And what are some of the specific strategies that you work with to help support youth and their families dealing with eating disorder?
It's a very complex disorder, as we've kind of talked about. Something that I try to emphasize is that we need to have early prevention. So the earlier you intervene, the better the outcome. So that's why I always say, it's important to connect with the parents and the family members of this youth, get them involved as much as possible. So I teach them in this therapy model we use. It's called family-based therapy. It's one of the best treatments for eating disorders. And it's really about emphasizing getting the parents to take ownership of the eating for the youth. So sometimes the youth can't eat anymore on their own because this disease has taken over their mind.
Wow.
And it's no longer possible for them to make a logical choice, a healthy choice around their nutrition. So the parent needs to intervene and say, you know what, it's time to have a meal right now. And you're going to have this meal at this time. And we really walk parents through how to do that in our services. But it's a very challenging disorder. Yeah.
I can't even imagine parents who are supporting teenagers, how can they, do they need to be conscious of their own eating habits and the eating habits of the household and the other family members? I mean, how does that come into play?
I think absolutely. We know that we live in a culture that promotes a lot of dieting and thinness as the most important thing, right? Above health often.
We hope that's changing with people like Lizzo.
Yeah, which it's still, there's a lot of backlash when you think about her, who she is, and there's a lot of people who are really against her, and you see that it's still very challenging. And we're seeing that there is a counterculture movement.
Yeah, slowly,
and it's still very difficult for young people during this time. So, and families. And I think it's important that parents really work on modeling behaviors that they want to see in their youth. So if they're talking about their bodies in a very negative way, the youth is going to follow suit likely, because they're going to see that that's acceptable behavior. Likewise, if you're talking about food in a very kind of good, bad, moralistic way, what that teaches to the youth is that, I'm a good person if I eat good food, like healthy food. Likewise, I'm a bad person if I eat junk food, kind of thing.
Yeah.
So we want to emphasize that it's just food. All foods have a place in our diet, in a balanced diet. And really try to reduce any labeling of food.
Does it start an eating disorder? Does it originate from what they're experiencing within their household?
Yeah, it's a great question. I would say I never want to blame a parent or say that the parent caused an eating disorder, because really there's no there's no way that that's possible, I believe. The factors are so complex. So there's a high genetic component usually. There's also, socio-cultural components. So we're thinking about the context that we're living in, the social
media, yeah,
the media that we're absorbing, as
yeah.
you said, and also just the emotional regulation skills. So there's a lot of different factors at play when it comes to the development of an eating disorder, and I really believe that the parents and families and caregivers are the key to healing an eating disorder. Yeah.
I love that.
Yeah.
Can you maybe share a little story that a success story?
Yeah, absolutely. That I would love to.
Yeah, I love when we can do that. It's important to give hope and show that it's possible and model that process.
For sure. I think, I worked with a youth and a family, and the youth had been really struggling with eating and had been, even throwing like the food out of their mouth, like chewing the food, taking it out kind of thing, not swallowing the food, basically. Mm-hmm. And of course, for the parents, this was horrific to see this because they were feeling as if, okay, what is going on? Like, what happened to my young daughter who we love? What's changed in the span of a few months here? Why are you all of a sudden a different person? And the parents were noticing that she was not, coming out of her room. She was very moody. These are all signs of challenging, maybe eating disorder behaviors.
And how old was she at the time?
She was 14, so quite young. And she lost a significant amount of weight, so 50 pounds in the span of, a year. Wow. And she wasn't hospitalized at that point, but it's so dangerous, to have lost that much weight so quickly. And in a young person, we know eating disorders can develop so rapidly. So I worked with the parents, and it's all about empowering the parents. They are the key in healing this disease. So they are the ones who can provide love, reassurance, compassion, and also firmness and boundaries, and say, you know what, we're going to fight this eating disorder, and we're going to ensure that you have your nutrition, your medicine, which is the food. So in the end, this youth had, gained a good amount of weight, and such a different person. Like, they were like, oh, my daughter is back. She was lively, she was engaged. And that's what happens when you are well nourished. You have energy to live your life. Yeah.
And how long was this process from beginning to end when you started working with them?
Right. So it does take some time. So it took about, 8 months, which is actually quite good. The fact that they intervened early is key. I think if there's any indication that you're worried for your child, or you're worried that there's something going on with eating, it's important to seek support, because the longer you wait, the longer this disorder can grow. It's much like a tumor in the brain. If you don't get, the medication, which is the food or the treatment, the tumor will grow in the brain. And we know that 1 in 5 people die from eating disorders. Wow. It is the deadliest mental illness. Isn't that?
I did not know that.
Yeah, it is the deadliest mental illness.
Wow.
Yeah. So we need, and in young people, it grows rapidly because the brain is so malleable and still very fragile at this age.
Yes.
So that's why the disorder grows so quickly. The tumor in the brain grows quickly, if I can use that analogy. And it's important to intervene early on to help reduce that impact. Yeah.
Wow. And I'm sure you have many other success stories, and because people that are reaching out to you and Youth Services Bureau are asking for help.
Yes.
Right? Is the majority, are the youth reaching out? Are their families reaching out? Who's reaching out to you?
Yeah, I think it's a very good question. I think we get mostly, actually, youth don't want to talk about this.
No.
They do not want to talk about it. They don't mention it.
They hide it.
They hide it.
Yeah.
And it's not, it's not necessarily them that's doing it, it's the eating disorder. If we think of it as this bully in the brain that's telling them 24/7 how awful and disgusting they are. And if they talk about it, they are going to be made to feel even worse. So they continuously hide it from everyone around them, which just inevitably grows that disorder.
Wow. How lonely.
Exactly.
You know, that's
So
a very
sad.
lonely place.
Right.
Very lonely and dark.
Exactly. And deadly, right?
Yeah.
Because can lead to hospitalization. So having parents even come in alone, that's a possibility where they can come in and ask for support to help their youth. I've worked with parents mostly alone sometimes, and that works wonders.
Well, like you say, that's the foundation for the work to begin, to solidify, to get everybody on board, to understand what's needed. Because they don't know, they've never dealt with anything like that before, and we have to learn new things in order to deal with it, right?
Absolutely. It's like we are teaching parents, not, when you have a kid, you think it's just parenting 101, right? 101 skills. This is like 2.0. So, like you need 2.0, like even more skills to help a young person with a mental illness. And that's what we do at our agency.
Wow.
Yeah.
Your work is so important.
Yeah.
Your work is so important, and we need more people like you in the world.
Thanks so much.
People who are watching right now who are struggling and haven't reached out yet, maybe a parent or a caregiver who thinks they may be dealing with a child with an eating disorder, what would you say to them?
I would say it would be important to come to our walk-in clinic. So we have a walk-in clinic every Tuesday and Thursday, and you can get seen by a therapist there and talk about those concerns. I would say reach out for help, because when you speak up, you will get support. And we are all about that at YSB.
Yeah, so important. We're all about that in this project too. You've got to rise up and speak out. It takes courage.
It does.
It takes courage even as a parent.
Absolutely. Yeah.
To reach out and ask for help. To know that they don't know enough to be able to help, and that they need help to know more to be able to help.
Yep. It does absolutely take courage, and I think this kind of program is really supporting that. So I thank you so much for that.
We all have a story. We all have a story. We all have a story around our mental health, and the more of us that speak up and share those stories. I'm sure you even have a story. That's why you're doing the work you're doing. That's why I'm doing the work I'm doing, And we're all in this together. I really believe that, It's a whole other level to the Me Too movement, making people feel like they're not alone. Yeah. So thank you so much.
Thank you so much, for your time and your work.
And the work that you do. Thank you, Leah. Oh, I love these conversations. I hope you've heard something here today that was helpful. And remember that we ourselves, we can reach out for help, but it's our responsibility to step up and be courageous as a parent, as a caregiver, as somebody in a community who's looking out for young people. And it's our responsibility to build our own roadmap, even for young people. We have to do the work to navigate ourselves to a place of mental well-being. We can't do it alone. We need help. And it does take courage to reach out and ask for help. It's the first step. We have a list of resources from the Youth Services Bureau here at the end of this video that you can tap into, so please do so. And we invite you to follow along the Dare to Be Vulnerable project as we bring you more conversations around our mental health. And we dare you, or encourage you, to dare to be vulnerable in your own life and have those courageous conversations with the people that you trust. It's your superpower. Remember, we're all in this together. Bye for now.